So here we're going to practice the passive range of motion technique with the knee. He's a little furry, so it's a little hard to see the bones, but I'm going to just kind of point them out, and we'll use my knee to show you exactly the landmarks. So here is where his knee is bending. So I can appreciate that this, because here's where the knee is bending, that this kind of cable feeling thing right here is his patella ligament. So if I feel on my knee, I bend my knee, if there's like a little cable here, and then this is my patella, right? So at the end of the bone where it begins to bend there, that's the end of your femur. So here on this dog is the femur, and here's the end of the femur. And if I want to confirm for sure that I'm there, I'm going to just go down and I'll say, oh yep, there's this rubbery cable thing, and I come up, and this is very hard and bony, so this is the same as here, my kneecap. And then I'm going to come down here further down. You follow the little cable guy down, and then you come to this other little bony protuberance here, and that is the front of the tibia where the patella ligament attaches. So this is tibial tuberosity, and then what we would call distal femur where the patella sits here. So this is how we know this is the knee joint. And we can feel if he's comfortable by taking the knee joint, holding his end of his femur here, and I'm just actually going to use his little ankle, and I'm going to bring his knee all the way to flexion. And so this is how we would check a patient's range of motion. How much flexion does the dog have? And if the heel touches the seat bone, this ischiatic tuberosity here, this little bone just like yours, if you bend your knee all the way, your heel should touch your seat bone unless you have limited range of motion. So here's, actually I'm going to put the femur in neutral. This would be a flexed femur, his hip is in flexion, and here would be an extended hip or extended femur, and then here I can just kind of put his femur in neutral. So here's neutral, and here's the hock joint, or the calcaneus, basically his heel, and it's touching his ischiatic tuberosity or his seat bone. So we know this dog has normal flexion because he doesn't care. If I got to here and it just kind of stopped, and the dog didn't have pain, but there was no way I could move it anymore, then I would say, well, this dog has this bony end feel, but you know, he's got a whole bunch of arthritis, but it's currently not bothering him. So you can have limited range of motion with no pain, or you can have limited range of motion with pain. So that's what we're looking at there. But to do passive range of motion, we would just support these two areas. I know I'm here at the end of the femur, and then I'm just going to do a whole bunch of this flexion, extension, flexion, extension. And if I'm assessing for comfort, I'm going to do more of an active range of motion. I'm going to kind of push his heel. That's active range of motion. But for passive range of motion, it's really just getting the thing to kind of move and get some joint activity going here to help stimulate the production of joint fluid. So there's flexion. And then if we want to assess extension for a dog that maybe has an injury, I would hold, again, end of the knee. I have his whole end of his knee here, and I got my index finger on his kneecap here. And now I'm going to bring his hock all the way into extension. I'm going to try to force it all the way straight. He thinks that's a little weird, but that's okay. His knee is actually really comfortable. So here is extension. My hand is supporting his bone here, basically his little heel bone. So when I do extension, I tuck the heel right into my cup, my hand on that there, and then I just hold basically his paw, his upper paw, and then I'm going to hold femur, index finger here on this little cute little kneecap, and then I'm going to say, oh, extend, flex, extend, flex, extend, flex. So that would be passive range of motion in flexion and extension of the stifle.